But we're going to continue in the interest of time. I'd like to introduce this next conversation that will focus on the power of academic and industry collaborations. Up to the stage here, we have Sal Lo, who's the co-founder and CEO of Jorie AI, Advanced Automation, and Dr. Ines Triay, interim dean of the College of Engineering and Computing, FIU. So let's give a warm welcome to our panelists.
Thank you.
Thank you so much. So what a pleasure to share the stage with you and with these fantastic students, collaborators, and I think that we're going to have a great time together. So let me start, by asking you to describe your company, Jorie AI, so that we understand this in context. That the advice that you're going to give us is something that you have lived and breathed, so you know what you're talking about.
Well, Dr. Ines, it's a privilege and a pleasure to be able to speak with you on this global stage at eMERGE. I want to, first of all, thank you for that. And also, I want to thank all the students that are here, that this is about their future, right? Give you a little bit of background of this collaboration with a public and private partnership and how it advances technology and where your space would be in what I call this technological revolution, right? Where has this happened before in history? How about the Industrial Revolution, right? Think about how long ago that was, manufacturing cars, et cetera. And now you have the privilege to be in the right time in the right place for another revolution. It's the technology revolution using advanced automation and supercomputing. All right, this is exciting for me because I've always been, quote unquote, a computer nerd. And giving a little bit of background on Jorie. Thank you, Dr. Ines, for letting me open up there. So Jorie is a global company, about 1,400 automators, advanced technology gurus, so to speak, across the globe that is focused on the finance of healthcare. Our background is healthcare centric. We owned and operated our own hospitals, surgery centers, clinics, but being multi-talented, multilingual, that you all folks should also understand, having a focus on different parts of your careers is key to driving automation. And I'll cut to the chase really quick. We are the provider for Walmart Health to drive this automation to 4,000 to 5,000 locations. For the VA, the largest health system in the United States of $138 billion. And we did it under 5 years, all right? To grow a global company under 5 years. It's being driven by the technology revolution, folks. You can do it as well. And we're glad to collaborate here with FIU today. Being on this stage kind of justifies what we're doing to initiate this mission and how we work with the institutions, the great institutions like Florida International University and their collaborations with organizations like Baptist and FIU, and now the engineering department who's creating amazing innovation. Thank you, Dr. Ines.
So I can't imagine better two fields to be in, AI and health. I think that if I had to choose two fields, those would be in terms of excitement, in terms of the impact that they can have if they decide, to go in the same direction. So let me ask you about the importance of industry-academia collaborations and how do you see these partnerships contribute to innovation in the engineering and computer science field?
It's tremendous. I mean, I can only say that. I can only say that it's such a huge, huge importance. And I'll let you know, I got to tour FIU for those, potential students here. You've got an amazing school, all right? The direction of innovation there is incredible, and a public-private partnership is key to success. And it has to start from the top. Speaking with President Dr. Gisel the other day, in that collaboration with Baptist and FIU, tremendous collaboration to not build it the same old-fashioned way, right? Why build a hospital in a legacy system, right? It's going to be transformed literally overnight. And use the automation and the advancement of the technology here today in collaboration with the hospital, using the leadership team or the know-how around you that's delivering it there. Is this new? Is this stuff that's untested? Guess what? It's been around for 10 years. We're just slow to adapt. Okay? But yes, that collaboration, Dr. Ines, especially with the engineering school, you're creating innovative wearables, innovative devices. How do you connect the data back to the electronic health record? How do you connect it where it's not limited in one container by automating what? A human being, all right?
Right.
Don't be limited. You know your EHRs, Epic, Cerner, Meditech, guess what? They're not going to be around, all right? I hope there's no one here from Epic, Cerner, or Meditech, but I would say this, that this is what innovation does. It transforms the way we're used to doing business and how we're delivering healthcare all the way down to not the hospital, not the surgery center, clinic, to the consumer. What are you wearing? You have an Apple iPhone? Check your blood pressure. Just put the Apple iPhone to your face.
Indeed. So what did you think about our innovation complex? I mean, for those of you that need to ask the question in context, FIU has a new innovation complex that is going to open its doors in 2025. But Saul was lucky, actually, to get a tour of our innovation complex.
Has anyone seen it? Has anyone seen the building going up? You got to see it. I have one word. It's very Gucci.
It is that.
It is so high-tech looking at, before it's even finished, it's already winning awards. But the ability to have it already compartmentalized to advance the innovation with innovation labs and engineering labs, it's things that I will never be able to do as an AI company, okay? So I know where my role fits is to collaborate with the best in class right there, because the institution that is to drive research and development into these devices is something that I already know that I will never be able to do that and be able to complete that many times over when your institution with your students are developing that research right there constantly, and then I can connect the dots from the data. But what a beautiful building and what a beautiful vision that you have. And I was amazed because these visions take place with a decision on day one, and on day, let's say 90, it's built. I just never see anything like that in my life, so that's incredible.
So tell us a little bit about, I mean, certainly your company and you have been at the forefront of AI, the AI discipline. And we wanted to ask you, what do you see the contributions of academia partnering with industry in the field of AI, robotics, automation, and if you want to also tell us about the multidisciplinary approaches and how do those contribute, to advancing the state of knowledge in these important areas, I would appreciate it tremendously.
I'll start with the last question, because the multidisciplinary approach is key to understanding how we succeed to deliver our products and services. Understanding that things that you felt were not related are now related. So what I mean by that is we focus on how to deliver healthcare, and we just talk about the things that we're doing in healthcare to create a device or use our automation. When, being educated by Dr. Jessel, the music school has something to do with your behavior for healthcare, right? How come you're not connecting the mental capacity of that human being into that healthcare delivery? So thinking outside of the box has to be part of your strategy to deliver something that a patient's going to use. How could I give that example? Right now today, I could pull my iPhone out and I could talk to the iPhone and it'll assess me for if I'm mentally challenged or not. And by the way, I'm not going to give you the answer to that, and you're not going to like it. But at the end of the day, your environment surrounding you is affecting the way your health is as well. So you have to think of, what are you eating? What are, how is your mood? These are different things that are multidisciplinary actions.
Like the One Health concept, right?
Correct. And being able to have the wearables and the engineering to wrap around that process, what you're doing at your school. Those processes can be now identified with things that you could really use at home. And that's really going to be the future of healthcare. You're not seeing it today, but you heard it today, where in the near future, everyone's going to have their iPhone staring at them, taking your health check.
Absolutely. No question about it. So as we prepare the students for what is to come, what would you tell them are the main skills that they need to acquire during these pivotal years in their careers?
Well, thank you. I really love speaking to the students to keep your curiosity open. There are so many ways that you can help and also be productive for the very near future, and it's super bright for you. You could segue it all the way down or narrow it down to things that are required for AI to be transformative. Some people might be more data analytics. Some people might be more cybersecurity. But think of how you wrap it around with the new technology that allows artificial intelligence to take whatever you do and multiply it by 400 or 500 times the production. Okay, and so as you go down that path and you're looking at your skill sets as students, look at different ways that you're bringing your talent up and focus on different features that are being utilized today. Are you a programmer for Python? Who knows if Python is going to be around in the next year or two, right? Continue to look ahead and collaborate with a focus that you love. I love healthcare. I want to do something in healthcare to save the rural hospitals from closing. Is that your vision? Start off with that goal and then reverse the math down to see, or process down to see where you land in the space. And guess what? If you set a goal like that, it's never going to be direct. It'll be left, right, center, and you'll finally get there, and you might have different choices that might reveal itself to you.
Indeed, I can't agree more with that. Many of my colleagues, my students, ask me, let me know, how did you charter your career? I didn't charter my career. I mean, so maybe I should ask you, did you charter your career? Or were there these challenges, that you felt so passionate about, that you would have done it for free?
All right, so if everyone wants to be an entrepreneur here, raise your hand, okay? Because it's not an easy life. I've never had a job in my entire life, all right? I don't know if that's a good thing or not, but I don't know. My mom wouldn't say, but anyways, another time. The fact of the matter is, you have to leverage everything you've learned in the past for what you're going to do in the future. And I know that's a generic answer, so I'll give you some examples. Early on, I was an investment banker, and I got rid of that role, and I looked at the finances, and I looked at basically technology, and I built a technology company back in the early days of telecom, and I grew it to about 150 million, and I was only in my early 20s. I thought everything would go up and nothing would go down, and was I wrong? Then I lost 100 million. That was a painful lesson, but it was a lesson. All right, now leveraging off of that, I built hospitals, surgery centers. There's many more things to come. And then took all of that knowledge, again, leveraging everything for the past 30 years and bringing back the technology to create artificial intelligence. That's the journey. Okay, so if you look at your life path and you've had some assets that you've built, don't throw that away. Leverage that for your future goals. And if you're lucky, you'll be in the right time in the right place. When we won over Walmart Health, is because of that global infrastructure and that barrier to entry that we leveraged from building hospitals, surgery centers, and a technology company that allow us to win over Walmart Health against billion-dollar institutions. When you realize that everybody has the same idea you have, then you realize that you have to do something that's different and leverages you more than anybody else. When I think about AI today, which I'll speak about here, I'm not going to talk to you about AI that I'm already thinking about that's 5 years or 10 years down the road. And that's what you should be also preparing yourself from the baseline of knowledge that you have from your career aspirations, whether you work in the restaurant business, the finance business, or whatever business. Leverage all the knowledge you have there to look at what that future model looks like with this technology revolution.
So yesterday, we were chatting, and one of the things that impressed me most was that you were telling me and my colleagues that, when you propose something, when you charter a course, it has to be a value proposition, meaning that many of us, because we come from academia, but we want to start this collaboration with industry, need to rezone our thinking some. And I would like you to tell our audience, our students, and our colleagues, talk to us about that value proposition. How do you actually see where is the money for your venture going to come from in the optimal cases?
So that comes with pain. When you're running out of money, you realize that money is important, right? Okay, so you have to fail to succeed. Okay, so the idea is that in a very basic thinking, you have to reverse the math. You have a great idea, but where is this idea going to go, and how is it delivered, and where's the ROI? Where's your runway? How much time do you need to deliver this technology or your idea? All right, that runway is important because there's a cost for that runway. You could have the greatest idea in the world and you run out of money, that idea never hits the market, and then someone else brings it to the market and you're like, hey, that was my idea. Guess what? There was a million other people with the same idea. They just had the financial formula. All right, and in my case, I have to raise 300, 400, 500 million dollars. All right, you don't all have to raise that. Okay, what I'm just saying is that that's in line with the scope of the runway that I need to drive an automation to the marketplace. And that's not just, hey, I raise as much money as I can. That's planned out on how much market share I'm going to capture by the funnel of business I've already signed on. And what happens if Walmart says, I want 4,000 to 5,000 locations tomorrow? Am I ready for that? Same kind of business model, same kind of plan that you all have to do when you think about the financial aspects of it. When I'm talking to Dr. Ines here, Dean Ines, in the engineering department, they're creating incredible innovation there. From things that are able to sniff out cancer, right? To medical devices that will help human mobility and look for Alzheimer's and epilepsy, treat those patients. At the end of the day, there is a price associated with that development, and there's a delivery or distribution channel to get it out to the marketplace. You have to be very sharp to do that, and if you're not, you better bring some people in to advise you on that. Okay, because that's step number one. And you are obligated before you go into that venture to basically do that financial planning. If you don't, you might as well go to Vegas because there's 100 people competing against you on the same idea.
I agree. I always see how entrepreneurs have a very holistic view, of what they're trying to do. And sometimes as scientists and engineers, computer scientists, we think that it's about our technical prowess. And that's granted, that is our technical prowess. But it's also about being able to put that value proposition together if you truly want to be a successful entrepreneur. So talk to us a little bit in the context of AI, automation, robotics. How do you look at these partnerships that we actually want to have between FIU and companies like yours in the field of health?
So let's pick on a major pain point in the United States. The trillions of dollars that are being spent in healthcare today and the billions of dollars in losses just on the administrative burden alone. Okay, $50 billion a year is spent on just managing diabetes. Okay, this is an incredible number. These are incredible statistics. And we do it over and over, year after year. And what do we do? We just continue to print money.
Absolutely.
Right? So you start off with that goal, all right? And let's say you're going to pick on diabetes and you're going to pick on some devices that measure your A1C at home. You look at what the cost of that care is and where it's being driven and where the price is being done at in the facility side, hospital side, where that's being tested out, or the laboratory. There's your target right there. How much money is that? Okay? How much money is that? What is your wearable going to do to check your A1C? All right, and how are you going to deliver it? What are you going to design for that? You start off with the problem, you start off with the financial goal, and you verse it back to the engineering. Are you creating a device that no one is going to use? Right? And so at the end of the day, when you plan it out that way, you have a clear path on what you're trying to do to innovate. And I think that's the key real world application, because in the academia, you're just trying to create the latest and greatest, most innovative thing. And I don't want to stop the creativity.
Of course not.
But you have to have a collaboration with boots on the street, with the finances, with the distribution channel. And when I say distribution channel, what am I talking about? So Walmart Health has 25 million consumers going in through their super centers every day. They're building 10,000 square foot facilities attached to their super centers to be impactful, to deliver healthcare in the United States. Do you think I'm going to be able to compete as a primary care doctor with Walmart Health? No, they've got the distribution. Do you want your wearable to go into Walmart Health? Let's talk later. We'll talk about that engineering.
Absolutely. You know, Paul and I will meet you here. And Russian is going to tell us, you know, which way to go, you know, with her great creativity and knowledge of the industry. So let me ask you a question with respect to curriculum. Many individuals have expressed to me and to others in academia that they think that there has to be an intentional set of courses on innovation itself, kind of not necessarily divorced, you know, from your field, you know, because you can understand how innovation works and then apply it to the field, to your field of study, the field that you have the idea, that you have the passion to move it forward. So what's your view there? I mean, is that necessary? Is it more necessary through internships, you know, through collaborations between private companies and academia? Talk to us a little bit about that.
So I'm going to give away some of my trade secrets right here, because, all right, so everybody, when they start off on this, whether it's a school or you all have the passion. All right, you all have the passion. Okay, that's a given. You're not going to be in here and you're not going to school for something you don't like to do. You're here you're passionate about what you do. All right. All right. So I have 1 million people with the same passion and idea. How do I organize that? Who rises to the top? Okay, so you have to look at the ability of when I look at it from a private and public partnership, is to give me a barrier to entry that no one else has, so I could deliver my product that no one else can deliver and create the distribution channel to get there. So what does that mean? That means that I rise up to the top and I win the business, and everyone else watches the television and go, hey, that was my idea, right? So you have to be competitive in your own space, is what I'm saying. This is a competition. I don't think anyone ever says that to you when you're in school. Learn your lessons, get out there, get a job, do well. You're in competition right now with every other student out there. I don't want you to kill each other, but I'm just saying that friendly competition, right? Tone it down a bit, right? But I would say this is that when we're competing for business, the idea is that I have to be on a stage like this, and I talk at HFMA, the American Hospital Association as well. They're all well-regarded institutions in the nation. And across the board, I do this because I feel like that the message has to cut through the audience. The collaboration with the university gives me credibility, in all honesty, is one of the assets that I think that I'm just going to be playing out and say it. It's great to be associated with such a credible institution like FIU. It also helps out my institution because when I step up in front of the stage at the American Hospital Association, I say this university is going through a lot of their engineering testing and using my automation. So a lot of that gives you the leverage to be on the forefront of the messaging that is what I call a very, very crowded space. Once you understand that, then you put your competition hat on, and you realize, are you going to win? Are you going to lose? Well, that's part of an entrepreneur. Sometimes you'll lose, all right? And I've lost many times, but I don't want to lose, okay? So at the end of the day, you continue to leverage all of this to get to a certain point where you're able to execute and deliver your message. Some people come to me and say, hey, Sal, I have a better automation than you. And I go, well, you probably do, but I have Walmart Health. So think about how you get to the marketplace and separate yourself out from the competitors, and I think you're going to find your way in a more friendly way to focus on how your career path is going.
So we only have a few minutes left, and I wanted to give you the stage to talk to us about the vision for Jorie AI and the place of these academia industry collaborations in that vision, and it better be with FIU. I'm kidding. So talk to us a little bit about that, so that the students and our collaborators here understand, the intricacy of that vision.
I think this is a win-win for me from the visionary perspective. Sharing a collaboration with FIU has to have the same alignment and vision. Otherwise, it's just a disjointed partnership, okay? And when I went to FIU and talked to Dr. Jezel, that vision was loud and clear. Absolutely. Okay, the hospital that's being built is going to be one of the most innovative hospitals in the world. Okay, that collaboration with Baptist Health to provide a residency program that's going to be founded on technology innovation is incredible. It's an opportunity to do it from ground level. I couldn't be more privileged to be a part of that. As far as the vision of Jorie is concerned, is we just want to make things better. Okay, so we want to create an ability to drive humanity to the highest level possible. And what I mean by that is, when we look at our business model, it has to be driven by patient care. All right? You look at our rural hospitals, and my goal is to make sure not one of those rural hospitals are shut down. Using our advanced automation, we can do that, and it will be profitable. Because when you do things that are good, the money will come right after it. That's our vision. There's more to the future here. You will discover it yourself. But if I tell you now, you're going to think I'm crazy. But I would say this, come and do some research. Look at FIU. Look at what they're doing in their engineering school. Amazing. Look at Jorie. Come to our website. Look at what we're doing in the automation. We're attacking $1 trillion of spend that's out there, saving billions of dollars from the healthcare institutions. And guess what? They're all signing up. I talked to about 14 CEOs, CFOs just yesterday. Yeah. Over a Zoom call. I can't travel that much anymore. But this will happen each and every day. My team here, Renata, if you want to talk to her later, and she could represent us. She's right in the front. But yeah, thank you, Dr. Ines, for inviting me here to be able to share that vision with your organization from a collaboration perspective of FIU and a private industry like myself.
Thank you, but we're not done. I think that what he actually said was that if you study AI, if you become an expert on automation or robotics, you will have a great job at Jorie AI. just no problem. You just call your colleague, and in you go.
We are needing talent, so please come see Renata here. So obviously, we welcome the idea to help the youth come in and to explore our company as well. Definitely, any Python programs out there, please see Renata ASAP.
It has been a pleasure sharing the stage with you.
Thank you so much. Thank you, Dr. Ines. Thank you. You're wonderful. Thank you.